Welcome to Moments with Marianne. I'm so delighted we're spending this time here today. We have a very empowering show coming right up with special guest Dr. Paul Thomas, and he's here today to share with us his new book, The Addiction Spectrum, a compassionate, holistic approach to recovery. Dr. Paul Thomas received his MD from Dartmouth Medical School. He's a board-certified fellow of the American Academy of Pediatrics and received his diploma of the American Board of Addiction Medicine. He taught residents and medical students from 1988 to 1993 and has practiced pediatrics for over 30 years. In 2008, he opened Integrative Pediatrics, where he currently serves over 13,000 patients, and in 2009 started Fair Start Clinic, where he's helped over 500 patients with opiate addictions in the Portland, Oregon metro area. So let's welcome to the show Dr. Paul Thomas.
Thank you, Marianne. It's my pleasure to be here.
What a joy it is to have you here. I'm so glad we get to do this again. My goodness, unfortunately, this is a topic that we have to keep talking about, but thank goodness we have experts in the field like you who are able to help people.
Well, we try. I hope I can say something that's helpful to somebody.
Yeah, well, the addiction spectrum, and that's one of the reasons we are having you back, because it has so much information. There's a lot there that I think gives a lot of people hope, because there are some things that, people just take as, that's what happens when people are addicts or they're predisposed, and there's all these different kind of myths. And I'd love for you to share what some of those myths are.
Sure. Start off with the myths. Well, for your listeners, just to qualify myself, I am an alcoholic in recovery. I haven't had a drink for 16 years. And I started off, honestly, just drinking for fun on weekends. And that wasn't until college, because I was on a mountain in Swaziland in a boarding school. I grew up in Africa. I am quite certain, had I grown up in inner city Portland, Oregon, where my children grew up, I would have been in trouble much, much sooner and much younger. And so we do know that the earlier you're exposed to drugs or alcohol, the more it damages those developing brains. So I was very, very fortunate. I am wired, and this starts to get to the myths. I am wired in a way that I'm one of those people, my brain is always on, and it's going really fast. Those of you who are listening who might relate to that, you know what I mean. For me, and there are some genetic risk factors that I know what my own risk factors are, at least some of them. I do have a family history, an uncle who was an alcoholic. I had workaholic parents, grandparents, and I actually have some genetic glitches, what we call single nucleotide polymorphisms. Sorry for the fancy medical stuff, but that make me vulnerable. Things like the MTHFR, the COMT. I'll just leave it at that. Some of us are genetically vulnerable to become addicted fairly easily. So, to get into some of the myths about addiction, the first one is always, of course, well, it's your fault. You're just an idiot. You have no willpower. What is wrong with you? Why don't you just stop? In fact, I remember my mom telling me very early on, and, I was just a kid in college, and she would say, Paul, why do you have to drown yourself? So I just had this phenomenon right from the get-go of put a little bit of, in my case, alcohol in my body, and my body craved more. I loved the effect. I think most people who become addicted, when they first experience their substance of choice, or sometimes it's many different things will do this for you, it actually brings relief, right? So if you're a super anxious person, if you have brain spin like I had, with a level of probably anxiety, no doubt, it just was like, that's better. Okay, now if I had perfect willpower and it didn't have that effect on me, I could have just said, I could take it or leave it, right? So anyway, I think we need to smash this myth that it's the fault of the addict. It's sort of like if you become a diabetic, so your pancreas stops secreting enough insulin and you become insulin dependent, we don't say to that person, it's your fault that you're a diabetic. Now, there may have been some risk factors that put you at risk for diabetes. There may have even been some lifestyle factors that you could have possibly done a better job of controlling, whether it was your diet, exercise, what you eat, et cetera, right? We don't need to go around blaming the victim of the disease, the person who's struggling with diabetes, or in this case addiction, and try to make them feel guilty for it. What they need is our support and our help so that they can actually overcome it. Which the good news is, and I have that throughout my book, The Addiction Spectrum, there are lots of things you can do. And actually throughout the book, I really stress the importance of getting into lifestyle things that you yourself, if you're struggling with an addiction, you can grab hold of these things and make some changes in your life. But back to a few other myths. I list 10, so maybe I'll just rattle them off, and then if you, Marianne, if you want to dig into any of them more, you certainly can. So it's not the addict's fault. That would be one. Successful people don't get addicted. No, I'm proof pudding that you can be very successful and be addicted. All it takes is willpower to stop addiction. Oh my gosh, did I think that was true. I struggled for 15 years knowing that my relationship with alcohol was not healthy, and I couldn't stop with willpower. I had willpower for everything else. I mean, I started a successful practice. I started other businesses. I took care of my family. Just about anything I put my mind to, I could do it, but I couldn't do it with the addiction because of the unique thing that happens when you have an addictive substance and what it does to your brain. Another one, the cause of alcoholism is alcohol, or the cause of drug addiction is drugs. No, there are a lot of predisposing things that make the addict or the alcoholic become active, right? Another one, it's okay for kids to experiment with drinking and drugs. They're just being kids. There was a doctor at a treatment center where my wife attended who, she asked him, well, Doc, are you an alcoholic? And he says, gosh, I don't know. I've never tried it. The reason he had never tried alcohol, actually that blows my mind that somebody who's an adult has never tried alcohol, but the reason he never tried alcohol is his family was riddled with alcoholism. He saw the negative effects and he thought to himself, I don't think I need to go down that path. So that's interesting, right? You don't have to go and experiment and possibly trigger a disease, in this case alcoholism or drug addiction, if you don't want to, right? So I don't think experimenting, especially the younger you are, the more vulnerable those brains are. Another myth is you have to hit rock bottom before you can climb out of addiction. Now, in the rooms of 12-step programs, whether it's AA, NA, or whatever, you will often hear, well, I had to hit rock bottom. And I'd say for some people there is some truth to that in the sense that you've got to, you might hear the statement, pray for desperation. If you get so miserable that you have to change or you're going to die, then maybe you'll do something. But the reason that's a myth in my mind is you don't have to go all the way to almost death. You can jump off that train at any moment. Because it is a progressive disease, it's pretty obvious how it's going for you. If you're struggling with an addiction, you're somewhere along that spectrum from experimenting to heavy use to can't stop no matter what. And, try to jump off that continuum before it gets severe and before you put your health at severe risk. Another one is if an addict doesn't want to be treated, there's nothing you can do. All right, perfect example of this one. My wife, at the point at which I did an intervention with her doctor, her counselor, her sister, a couple of her closest friends, she did not want to go to treatment, but she desperately needed it, and it saved her life. And I am blessed with the most amazing wife you could ever ask for. Every year just gets better and better, but she was dying. It was right after I got into recovery. I'd been dying, in a sense, that inner death you have when you have an addiction that's just eating you alive. So you don't have to wait until somebody wants treatment. Most of the time, addicts and alcoholics won't want treatment because, you see, their substance is what has, in their minds, saved them 1,000 times from whatever distress, pain, anguish they might be experiencing, emotional or physical. Another myth, drinking and drugs are fun. Sober is boring. I actually thought that. Back when I was drinking, and, the news is just all over the place, right? The people who are drinking are the ones who are at the party. They're the ones having fun. And we get these images from the time we're a child, and you get to the point where through high school and college, you start to really believe it. You have to do this to have fun. I didn't know until I got sober 16 years ago how much fun you can have sober. Actually, it's just as much fun, and even more, because you're more present. And what happens is, here's the thing, we just make an association, right? So if you start having fun activities and you drink, let's say, or do drugs while doing those fun activities, that association becomes linked. But talk to sober people who don't drink or use drugs, interestingly, they're having just as much fun or more. So it's not that the drugs or alcohol are making you fun or that being sober is boring. It's just an association that gets made, and the people who do advertising on TV, et cetera, are really good at helping you make that association. Two more, and I'm done with all these myths. Sorry, I've been rambling on you. Sorry about that. It's all in your genes. You are hardwired to be an addict. Well, as I started off, there is a little bit of truth. There are risk factors in our genetics, but no, there is no gene that makes you an addict or an alcoholic. It's a number of we call them environmental factors along with your genetic risk factors that make you more predisposed to perhaps going down that path. And then finally, making lifestyle changes cannot help an addict. Oh, that couldn't be more wrong. It is absolutely in your power to make lifestyle changes that can completely turn your life around if you're struggling with an addiction. All right. There you have it. 10 myths about addiction.
Well, I'm glad that you went over those, because a lot of times people have these erroneous myths when it comes to addiction, and so it also lends them, maybe they're like, well, I don't really think I'm an addict or I have a problem. And, today's the day after, St. Patrick's Day, which is a day typically people tend to overindulge in alcohol. The consumption level is really off the charts. And so the next day they're kind of going, I wonder if I have a problem. So for those people that are kind of going, gosh, I don't know if I have a problem or not, I mean, what would you say to them?
Well, I would say this. Try going a month without any drugs or alcohol. And if that's a total piece of cake and you can take it or leave it, my guess is you don't have a problem. Now, in the early phases of over-drinking and as you're approaching an addiction, what you'll notice is when you do this experiment of going a month without drugs or alcohol, you think about it all the time. And if that's true for you, you probably do have a problem. Now, it's really important for if I'm a family member of somebody who I think has a problem, I can't go tell that person, hey, you've got a problem. Although, being a little bit of a mirror and maybe asking loving questions might not be a bad idea, just hoping that they'll take a look at it. My mom telling me, for example, as I said earlier, why do you have to drown yourself? And, I wasn't very self-reflective back then. I didn't even get it. But I've noticed, it's funny, I was just at a meeting early this morning before our talk with you, Marianne, and one of the people at the meeting said, it's interesting here, I'm in Portland, Oregon, and she said, it's interesting that most of the eating places around here that are open in the morning are now serving alcohol early in the morning with breakfast. And I guess it's a thing in Portland. I don't eat out for breakfast ever, so I wouldn't have known that. But for alcohol in particular, if you are needing a morning drink, that kind of eye-opener they'll call it, or got to get the day started, you're probably in trouble. You're in big trouble because your liver is never getting a chance to be totally free of the toxin that alcohol is. So alcohol has to be metabolized in the liver, and it can only metabolize it at a certain rate. And if you drink heavily at night and then you're having to drink in the morning to get rid of the shakes, you actually ought to see an addiction specialist, and you may even have to be detoxed either inpatient in a hospital or in a treatment center where they can handle an alcohol withdrawal. But that's more end stage. Most people who are wondering if they have a challenge with alcohol, the simplest thing is just go without it for a while and see how it goes.
Well, and, on that note, I'd also like for you to talk with us about, because we've got all these states that have made pot legal, So it's something that's kind of going across the U.S. And so
Yeah.
the old question is actually coming up is cannabis a gateway drug? And what are your thoughts on that?
I have a chapter on that in my book, The Addiction Spectrum. So I run an addiction clinic. I'm also a pediatrician and run a huge pediatric practice. What I have noticed is that the few kids who ended up moving over from my pediatric practice to my addiction clinic, almost to a person, started with cannabis, with marijuana. Does that make it a gateway drug for most people? Maybe not. I mean, there are people who drink alcohol and never start using heroin, for example. They wouldn't dream of using heroin. And there are people who use marijuana who would never dream of using heroin or meth. But in my clinic, where I'm dealing with primarily heroin addicts, almost every single one of them started with marijuana in their mid to early teens, experimented with alcohol, ended up on opiates. In some cases, they got an opiate prescription from a dentist from a tooth, removal or something, and just loved the effect of opiates so much that by the time they had finished their prescription, they were getting another one, and then they were already addicted, or at least physically dependent. So there is that sort of transition from you like the effect to you become physically dependent on something. And once that happens, you keep running that process where you have withdrawal, so you take your drug of choice to stop the withdrawal symptoms. Now you're addicted. But as for marijuana and the laws that are changing, Oregon is one of those states where it is now legal recreational marijuana and medical. And so we have dispensaries, oh my gosh, there's probably over 100 of them in Portland. In a little tiny town at the coast, there's 3 or 4. It's like almost every third block. What do I think about this? I, as a pediatrician, am nervous, very, very nervous for our children. Alcohol is legal. That doesn't mean it's a good idea. Alcohol is a poison. It really has virtually no medical benefits. I mention a few in the book, but they're pretty controversial. You're just better off not drinking. Marijuana, in my opinion, THC, is fairly close to that. Now that it's legal in many states, does that mean it's a good idea? Definitely not if you have a developing brain. So there's plenty of studies showing permanent brain injury, decreased ability to focus, to concentrate, to learn in adolescents and young adults who are using marijuana. So whether you're a teenager or early 20s, college age, plenty of literature and studies showing this is not a good thing. When are people starting marijuana? At exactly those ages. So I'm nervous about it. I mean, if you think about just wanting to be in charge of your life, do you want to take a substance into your body that zaps your motivation? Sure, it's calming, can put some people to sleep. It also makes some people very paranoid, and that also makes me nervous. I have yet to find a schizophrenic person who didn't use marijuana before they became schizophrenic. I am not saying that marijuana causes schizophrenia, but there are known documented cases of psychosis, depersonalization triggered by marijuana, and it can be your first time or your 100th time or your 1,000th time of using marijuana or THC, and all of a sudden you're dissociating and you can't stop it. It's like something happened to your brain and you can't get it back to baseline. That would scare the bejeebers out of me into not wanting to ever use marijuana. Does THC have some medicinal purposes? Absolutely. We have receptors, cannabinoid receptors in our brain, and it's been found to be helpful for cancer patients who can't eat. It helps them restore their ability to eat, their appetite. There's some immune boosting effects, and there's some other benefits, anti-seizure, for example. Now, CBD is the cannabinoid that you find. It's in marijuana plants, but it's also much more available and pure in hemp. And I find that to be much, much safer. In fact, I don't really have a problem with people using CBD for its benefits to the immune system, anti-seizure effects, and it's somewhat calming for people who have anxiety. And I'm sure there are lots of other potential uses. But yeah, to answer your question in short, I am very concerned about the spread of marijuana being recreational and just being okay. I sort of think of our people are going to be like sheep in the pasture and, go to work, pay your taxes, and don't bother us. We've got you. Pay your taxes, though. And they tax marijuana very heavily. It's very lucrative for the states, which is an incentive for states to legalize it.
Yeah, I know when it was first rolled out in Colorado, I mean, the state made a ton of money, and then also with the tourism that was coming in from other states. So
right, just for marijuana.
Yeah, but they were talking about different things, as in, homelessness went up 500%. And there were all these other different factors that people weren't really considering when we look at, what when people become involved in doing drugs,
Mhm. Yep. Absolutely. I mean, I've raised 10 kids, so I've seen a few of my children were fairly heavy users of marijuana. I just wasn't able to control that. And they were universally the least motivated. You could just tell. I mean, all they want to do is sit around and play video games. That's not the road to success. If you're a young adult or a teenager, you're really derailing your future.
Yeah, I mean, there's so much. I mean, just the whole brain thing you were talking about. I don't even want to get secondhand smoke,
Right. Yeah, I have a picture in my office where they show the brain of a normal brain on a PET scan where it's all colorful, and then the brain of a heavy marijuana user, and you see the brain is literally eaten up. I mean, it just looks like somebody took bites out of it all over the place. It is permanent or significant brain damage if you're a heavy user, especially if you start young.
Wow, that's some scary stuff. Well, and I want to touch on another type of addiction because I've got more questions, and obviously we always have time, but I'm so glad we're talking about this because there also seems to be a rise, and maybe it's just what I'm seeing, but you hear about that, food addictions are now a big thing as well. And there seems to be a rise of people that are having issues with that. And what are your thoughts on that?
Oh, goodness. There is no question. One of the ladies who I interviewed for my Addiction Summit, her story I don't think is in my book, but she was a heroin addict, but also a severe food addict to the point where she almost killed herself with food. A very extreme case of food addiction where, I mean, the type of thing where you're going to sit in your car and just power boxes of Oreos while you cry. And it can get that bad for some people where now food, like alcohol, like opiates, like heroin, like meth, all these substances boost dopamine. So what we're doing when we're addicted to something is we've artificially propped up our dopamine, which is our feel-good hormone, neurotransmitter rather, and when it runs low, which it does because we keep depleting it by overstimulating it, then you just have to somehow get it up again. And so you keep taking your substance of choice. If it's food, the higher sugar content, the higher, more processed it is, like the flour, the cookies, crackers, chips, cakes, sweets. These things will just give you that brief little boost of dopamine that just, you momentarily feel better, but it doesn't last because it's such a tiny little boost. And so, yes, you absolutely can get a food addiction. I kind of wonder. So I'm a pediatrician primarily. I've raised many children. I didn't do it right when I was raising my kids. I was busy early in my medical practice, super busy, and we just fed our kids convenience stuff. It's horrible to think back. I figured it out by the time they were teenagers. I was cooking with real food, and we were doing much better. But when you've got a toddler, my youngest ones, my first kids, the first go around on this, wanted apple juice, crackers, cookies, cereal, just, fast junk sugar, and I wasn't paying attention. If you set your kids up with already they're wanting to have that quick fix, that that sugar fix, that, whatever it is that's giving them I bet it's giving them a little dopamine boost. What did I do to them that might have later on, when they're needing to self-medicate, now they're turning to whether it's marijuana or alcohol? So parents, if you're listening and you have young children, oh my gosh, what an opportunity to get the junk out of the house. If you start when they're infants and all they eat is real food, they'll have no problems with it. It's once they've been ruined with cake and cookies and, it's probably the grandparents' fault, but no, I'm just teasing. The grandparents love to spoil their grandkids. But as a parent, do what you can when they're really little to set the stage, and you're really helping them out.
Well, isn't that the truth? I mean, grandparents do like to do that, but with information, they can make changes and maybe look at things that are, that don't have such a high sugar content, that these kids aren't getting that hit from.
Yep, absolutely. Absolutely. I think we need to rethink how we do parenting as far as the food and as far as, you want to love, nurture, reduce stress, but not let them overstimulate themselves with dopamine artificially. Mm-hmm. And we want our kids to just be out in the world, out in nature, and getting a natural high that they can carry with them and translate into adult, maybe being more physically active, eating right, and yes. Now, stress is the other thing that is an X factor when it comes to addiction. I really think our society is putting an enormous amount of stress on teenagers, young adults. I mean, everybody I know, even my adult employees at my office, people seem stressed out. And stress might be hidden in your screens. I talk to my teenagers all the time about screen time. It is one of the big new addictions. And that might come to our listeners as, what? My phone is my addiction? Mm-hmm. Think of it as a little mini crack cocaine. I give the example when I'm talking to I do prenatal visits to start out almost all my days. So in my pediatric office, I'll start my day with a brand new couple. Mama's pregnant, and they want to know what to do to have a healthy child in today's world. And I say, eat real food. You're going to supplement with vitamin D. And then the really big thing is stress reduction. And I pull out my cell phone and I put it down next to me on my desk, and I say, and I'm looking at them, and I say, now when this alert goes off, what do I do? And my eyes shift over to the alert, and I go, oh, it's okay. It's just, my kid or my wife or whoever, right? Not that they're not important, but what do we do as humans? We are animal kingdom creatures wired to scan for danger. And so what that is a little danger response. The alert goes off, and I go, danger? Oh, no, it's not danger. So if you're scrolling social media, it's the same thing. Each time you flip or scroll, there's a momentary danger. Oh, it's okay. Danger. Oh, it's okay. Those tiny little blips of neurotransmitters being released in your brain add up. And we were not wired to have 24/7 constant little hits of danger signal. And so we are absolutely depleting our brains of dopamine, norepinephrine, and it leaves people stressed out, anxious, depressed, suicidal, no focus. And the most impressive example of this, I can't remember if I told this last time we talked, but I'll repeat it just in case because it was just mind-blowing. I had a 16-year-old girl on 2 meds for depression and anxiety, suicidal, couldn't get out of the house to go to school. She was so stressed out and couldn't focus on anything. She left my office, had a concussion playing soccer, was put on total brain rest, and a month later she was absolutely perfectly healed. Depression gone, focus fine, happy. It was like, wow, how much time are you spending on your phone? Oh, quite a lot. I said, well, how much is quite a lot? Probably too much. Well, how much is probably too much? 7 or 8 hours a day. And that is the average amount of time teenagers are spending on phones in this country today. It's just way, way, way too much, and it is probably the number one addiction affecting our teenagers today.
And then no wonder they're stressed out, because if they're getting this, kind of flight and fight response every time the phone goes off, and they're looking,
yep.
And they're so attached to what people are saying, there's no winning there.
Well, on that note, we're going to pause here for a quick break. We've been speaking with Dr. Paul Thomas in regards to his new book, The Addiction Spectrum, a compassionate, holistic approach to recovery. You've been listening to Moments with Marianne. We'll be right back after these messages.
Internationally recognized and award-winning author Judy Goodman works and teaches outside the box of limited thinking. Working with people from every walk of life, her goal is to empower you to be the best you can be, no matter what the challenge is. Born with the gift of seeing beyond our normal vision, she has an extraordinary gift of working with every challenge. Teaching beyond conventional wisdom, her work is described as life-changing. Visit judygoodman.com. That's judygoodman.com.
There comes a moment when you realize you're somewhere special, when you discover that each beautiful creature that you see has been rescued from a life of absolute horror and brought to this incredibly free place. Here's where their lives were forever changed and where yours will as well. Discover over 500 tigers, bears, and lions at the brand new visitor center at the Wild Animal Sanctuary just outside Denver. For more information, visit wildanimalsanctuary.org. Discover true freedom at the Wild Animal Sanctuary.
Have you ever had the sense that your thoughts might actually be doing something? Ancient secrets of manifesting have been masterfully revealed in the award-winning book Manifesting 123 by Ken Elliott. For the first time, the author's experiences and stories in this book describe exactly how your thoughts can create anything. You've been doing this all your life, but it's never been fully explained for you until now. Visit manifesting123.com for more information today. Manifesting123.com.
There are nearly 2 million Americans living with amputation. Many live right here in San Antonio. Becoming an amputee can be scary, frustrating, isolating, but there's no reason to feel alone. The San Antonio Amputee Foundation is here to help support you and guide you toward resources such as home and car modifications and even prosthetic limbs. For more information or to make a donation, visit saamputee.org. We'll help you live a full, active life, one step at a time. San Antonio Amputee Foundation, healing limbs, hearts, and souls.
Welcome back to Moments with Marianne. We're here today with special guest, Dr. Paul Thomas, in regards to his new book, The Addiction Spectrum, a compassionate, holistic approach to recovery. Now, Dr. Thomas, before we left for break, we were talking about how our phones or devices are putting people in this fight and flight category, and they're not really getting rest, and it's kind of leaving them a little bit fried. And I'd love for you to share your thoughts on this.
You can't get away from it, so you have to be intentional about how much time you're spending on your screens. And what I tell people is turn off your alerts. My wife forced me to put my message alerts back on. She says, I can't get a hold of you because I turned them all off. I just turned them all off because I realized, even though they don't stress me out, and that's the thing that confuses people. Those alerts, when you see them, you don't feel, oh, I'm stressed. Not at all. You go, oh. But it is that little constant hit of the stress hormones in your brain because of the way we're wired. So, yeah, it's such an important factor today. I really, really think we've got to become aware of that. And back to your food thing, starting very young, eating real food, trying to eat organic to avoid toxins, super important.
Yeah. I don't think people realize how important organic is where you can, because it really is. And I think we talked about this last time. I mean, I was in California driving in between. I had farms on one side and farms on another, and a crop duster was spraying the fields. and he did not stop when he went over the highway. And it took them 3 times washing my car, going through the car wash to get that sticky stuff off my car. And that's going in our body.
Oh, my goodness. Yep. Oh, it's horrendous, the amount of pesticides and herbicides we're putting in our bodies, and it's such a toxic substance. I mean, if you think of the word pesticide, side is to kill, right? You're killing pests. Well, all of these pesticides and herbicides, whether it's glyphosate, Roundup, or the newer hybrid versions of this stuff, it destroys cells, and it destroys the stomach linings of the bugs that are eating anything that has this on it. And we wonder why so many of our kids have food sensitivities and gut issues. It's not a surprise to me. Not a surprise at all. So do what you can, starting from pre-pregnancy, for sure when you're pregnant, and then for your babies, and then infants and toddlers and what have you. Go organic as much as you possibly can. It is absolutely worth it. I like to tell people it's never too late and it's never too early to implement a wellness plan that will help you take control of your addictions, your health, and every aspect of your life. I mean, if you're listening to this and you think, oh my gosh, I've blown it, I've ruined my kids, or I've ruined my life, no, start right now. It's amazing the healing abilities our bodies have once you give the body the nutrients it needs and you start removing the toxins that you're exposing it to. We heal very quickly.
That's very encouraging. And that's one of the things that I like your book for many reasons. The addiction spectrum really goes over, not only, information that people, either if they're going through addictions or people who have loved ones are, but it gives information on, as far as what to do, some suggestions, information, and hope. It really does provide a lot of hope.
Yeah. It's a very simple to read book, don't you think?
Oh, it is. You make it really, I can go through any of this and go, gosh, I didn't know about, when we were talking about cannabis, like what it does for the brain, because you hear a lot of people go, well, it's natural, it's it's got to be healthier for the body,
Yeah. Poppies are, opium is natural too. That's where heroin comes from. It's just natural.
Oh boy.
Right. So
well,
you have to be careful of natural. That's a tricky one. Yeah, that's absolutely a tricky one.
Kind of a little bit of a scapegoat. Well, and so, I'd love for you to share with us your thoughts on why, we've talked about several different types of addictions, and what really keeps people stuck in that cycle.
So I think, honestly, the underlying pain that one is feeling, and it might not be pain like a broken bone pain, it might be emotional pain, you're looking for relief. And so you turn to your substance because it's provided you some measure of relief. When you get that little boost of dopamine, you just feel better. Now, once you're actually dependent physically on that substance, whether it's nicotine in cigarettes, food, your screen, alcohol, opiates, meth, whatever you might be addicted to, sex, gambling, there's behavioral addictions that give you that little boost of dopamine that you just for a moment feel a little better. You're into that addictive cycle. And it's very, very difficult to break it.
Mm-hmm.
Yeah.
But there is hope, though, so they can...
Oh, absolutely. Absolutely. When you start kind of addressing some of the underlying issues. So let's say for me, I'm wired hyper and anxious, and I've got a lot of insecurities because of it. And then I get some counseling, for example, just a simple thing, or I do some work in that area with various programs that can do that kind of work, and I address those underlying insecurities and issues, and I'm now feeling more secure. I am now better equipped to go through the discomfort of reducing my substance use or perhaps stopping it altogether. If I am eating a really good, nutritious diet with lots of green leafy vegetables and colorful fruits and vegetables, we say eat the rainbow, and it's organic, and I've got omega-3 fatty acids, which is your flaxseed if you don't want to do fish, or a fish oil, and I'm getting protein that's free range, or at least it's, not loaded with saturated fats. I'm eating a really healthy diet. I'm supplementing my vitamin D. Maybe I'm taking extra methylfolate. For a lot of people with MTHFR, you need to make sure you're taking methylfolate. So I'm giving my body all the nutrients it needs and reducing stress, and I'm dealing with some of the underlying things that keep me uncomfortable or in emotional pain. Now I have a much easier chance of being able to deal with the substance that I've been sort of using to mask my problems. When people get into recovery, and we use that word recovery, meaning you're putting your addiction behind you, right? But it's a journey. It is not a one and done, oh, good, I'm cured. To this day, last night, I was at a 12-step meeting. I just preventatively don't stop going. I go a certain number of times. In my case, it's just once or twice a week. Early on, I was almost every day. That's what I needed to get the reinforcement that I could do it, right? Because there's a lot more discomfort early on when you're stopping your substance that's been your relief. But once you get on that journey, and if you're taking care of the nutrition and you're reducing toxins and you're reducing stress and you're getting your sleep, your self-care, you're getting exercise, it actually, not only does it become easier and easier, but life gets more fun. I feel like a little kid again. Now, that is not how it felt the last 10, 15 years of my addiction, of my drinking. I was just gutting through the day till I could get home and have some more alcohol. And then I'd pass out and get up and do it again. And it was a miserable existence. If you're listening and you know that miserable existence, what I'm talking about, where you have to have your substance because you feel so horrible if you don't, and if you don't take it, you just don't think you can make it through the day, so you take your substance to get through the day, you start to feel that emptiness, you start to wonder if life's even worth it. What am I doing this for? I was there. I know what you're feeling. You don't have to be there anymore. You just get into this book, get into the lifestyle changes that I'm talking about right now and that are outlined over and over in this book, and then get some professional help if you have an addiction that's so severe that you're not going to be able to do it on your own. And you can get your life back. Oh, to see the lights come on in the young adults I'm taking care of who have heroin addiction, and pretty quick, they're back. Their lights are on. They're starting to get excited about life, and it's life-saving. That's the other thing. The opiate addiction, of course, it's hitting all the news, right? All the deaths. Mm-hmm. 30,000 just opioid overdoses in 2018. Was it 2017 or 18? Sorry, I don't have that stat right in front of me, but way, way higher opioid deaths than we've ever seen before. And part of the reason is that they've spiked the heroin these days with fentanyl. There's also something called carfentanil, which is elephant tranquilizer. It is 10,000 times the strength of morphine. A grain of salt of carfentanil in your heroin will kill you. Well, the poor folks who are addicted and dependent on heroin to just get through the day, you shoot up with some tainted heroin that has carfentanil, you're dead. So you need Narcan. If you have a loved one who's addicted to opiates, make sure you have Narcan. It's now available in the pharmacies, most states without a prescription. Nasal Narcan, you just squirt a squirt in each nostril and you'll bring them right back to life. It could be life-saving. So that's just one of those little things to think about if you happen to have a loved one who has an opiate issue.
Well, and the great thing is now that there's so much discussion in regards to addiction that there's also a lot of help and resources like your book, and I know you work with people as well.
Absolutely. I also did an addiction summit this past summer. You can still go to theaddictionsummit.com and get a 7-day free access to that summit. I interviewed 28, well, I was one of the 28, so that means 27. I interviewed 27 different experts, largely in the area of how to empower yourself to take care of your overall health when you are chronically affected by anything, but with a focus on addiction. So it's a very nice, powerful summit. Actually has a whole lot of wisdom in there that's I did the summit after writing the book, so I wish I'd done it the other way around. I could have shared even more wisdom. Maybe there'll be an addiction spectrum too someday.
I think there needs to be one. If not book, definitely the summit, because there's just a lot that needs to be discussed on that front. A lot of people need to hear that information and maybe in a lot of different ways.
Yeah. You know, our society is, people know this, we are all struggling with chronic health issues, and that's not how it was 50 to 100 years ago. 50 to 100 years ago, it was all about infectious diseases, and everybody was worried about all the various infections. It's a different world today. Over 50% of kids graduate from high school on a medication, on a chronic medication. You know, people are struggling with all the neurodevelopmental stuff, be it autism, ADD, anxiety, depression, addiction, et cetera, right? Or it's, you know, immunosuppressants, autoimmune issues, whether we're talking diabetes, MS, rheumatoid stuff, inflammatory bowel disease, celiac, the list is long. That's a consequence of our poor diets that are lacking in nutrients, the nutritional deficiencies, and then the toxic world we live in, from environmental toxins, but be they pesticides, herbicides, flame retardants. There's a list of, you know, hundreds of toxins in our environment. And you might, if you're listening, you're going, well, I can't deal with that. It's too much to think about. I would just urge you to think about the things you can control, because when I'm sitting with a new couple and they're about to have a baby, I tell them, you can absolutely have a healthy baby in this crazy toxic world of ours. Here's what you do. And we talk about eat real food, supplement vitamin D, reduce stress, fix your biome. That's your internal gut environment with eating fermented foods and taking probiotics, and fix your external environment, which is the people you hang around with. Don't hang around with stressful people while you're pregnant. Well, that's good advice for all of us, right? I mean, if there's somebody that's toxic in your life and you can possibly put some distance between that person, you're going to be happier and healthier for it, both emotionally, mentally, but also physically. And so there are a lot of things we can do in this crazy world we have to have really full and exciting lives and not succumb to these chronic things. And like I said before, if you are already struggling with it, it's an addiction or some other chronic thing, dig into this book, The Addiction Spectrum. You apply this advice to any chronic condition, and I can almost guarantee you'll be shocked at how much better you feel.
How about for those people that say, okay, you know, I've been through rehab a couple times and it didn't work for me. You know, what are your thoughts on that?
Yep.
Like, is relapse kind of an expected part of recovery?
Excellent question. I tell every new patient the very first time I see them, and I'm sitting down with them, usually at that point, we're in a room with the patient and one of their loved ones. And I say to them in front of the loved one, because I want them to hear this, relapse is expected but not required. And I say that because most of us who have had an addiction relapsed 100 times, maybe 1,000 times before we finally got it, before we finally were free of that addictive substance for once and for all, because it is so powerful when you've become dependent to an addictive substance. The effect it has is so alluring and so powerful. I mean, you just feel better that even if you go a time without it, as soon as you have a weak moment or whatever and you take it, you instantly feel that amazing rush of euphoria, and you're just, if you're not careful, you're boom, right back there. So yes, relapse is part of the process. If it's your loved one who's relapsing, oh my gosh, it's painful to watch. It is so, so difficult. I had a good friend, 15 years ago or so. He was a lot younger than I was, alcoholic. His parents mortgaged their home, cashed in their retirement. He went to treatment center after treatment center, and he just never got it. And it was just tragic to watch that. And I know what that feeling is, because I've had to make that mental calculation. A few of my kids have struggled with addictions, and I'm going, would I mortgage my house? I don't know. I don't know what to tell you. If you're sitting there listening going, what do I do? I would say watch your self-care, because, you know, your addict family member or close friend will get it when they're ready. And sometimes I think the reason treatment fails is it happens because the family wants it more than the addict themselves. So that doesn't mean you shouldn't try it. If you can afford to try it, because sometimes you're lucky one time and boom, they're good. And it's like such a blessing when that happens. But if you come out and you relapse, either the treatment didn't fully address the issues that needed to be addressed, or the person just wasn't ready. So this is very common in the young. You get a teenager and you send them to treatment. They're not ready to be done. They're just getting started, all right? So it can be really tricky. But on the other hand, sometimes you get lucky and they get it. They go to treatment and they go, oh, my gosh, I'm never touching that stuff again. So I'm not saying don't do it, but it's best if your addict wants it. It absolutely is best. The other thing that happens with relapses in treatment is the treatment center takes care of them while they're in the treatment center, but doesn't really set them up with a proper extensive aftercare program. And you need your addict or alcoholic who's in treatment to be very plugged into 12-step recovery, ongoing counseling, to have a really supportive program that's very well worked out and will be implemented for them to be successful. And one other caveat about after treatment is when you're talking about opioids, if a lot of the treatment programs used to, and this doesn't happen as much anymore, but it still can happen. If you take somebody who's on very high-dose heroin or methadone and you put them in treatment and you wean them off, so you get them off their opioids fairly quickly, they will feel very anxious, no energy, have a hard time sleeping, and be just craving their substance, sometimes for months. It just takes a while for the brain to heal after extensive high-dose opiate use. So if you take that person out of that safe, secure treatment center environment and then you send them home and say, well, I want you to go to some 12-step meetings, they'll probably last a day because finally they can feel good again. They have been miserable, sober, yes, they're not using, but they're in this artificial protected environment. The other place that happens is prison or jail. And then the moment you get out, it's like, finally I can feel better, and they go use a little bit of opiates, and bam, they feel so much better, they're instantly back into it. And within days, they're right back using as much as they were using before because the tolerance comes right back. So the tool I use for opiate addicts is a partial agonist, partial antagonist, a medication called buprenorphine. One of the brand names is Suboxone. If you give an opiate addict this substance, it won't get them high, but it blocks those receptors so they can't get high if they relapse. And so at least they're feeling better because they get some partial opiate effect, and they have some time for their brain to heal, for them to heal their social environment, rework their relationships, get back to working, get a stable place to live. And it's a wonderful tool that enables people to be successful when they've had a long run of high-dose opiates. And so I'm a fan of that one. I'm not a huge fan of harm reduction, although it has its place. And that would be the example of, say, methadone clinics. If you take someone who's been on high-dose heroin for decades, you're probably not going to be able to have them go opiate-free. And so at least if they're taking methadone regularly, it's a controlled dose, and they can be more functional and less likely to overdose. The thing I don't like about the high-dose maintenance programs or harm reduction programs is there is a downside negative to your health by being on very high-dose opiates. Opiates suppress the pituitary. It's a little gland in our brain that's kind of the master gland for all hormones. And when your pituitary is suppressed, your thyroid becomes suppressed, so you're tired, you have low energy. If you're a man, your testicles, testosterone is reduced significantly, so you just kind of have the blahs, and that whole sexual part may not even work. So there's a lot of things it does that don't really give you vibrant health like I think people should have. I want everybody to be back to think of yourself as a child, if you had a good childhood, that is, and that's the energy you want. Let's get back to that, and it is possible following some of these lifestyle things I talk about in the book.
Well, and I think I have time for one more question here. So if we're talking about, because we've talked about addictions when it comes to, different opioids, but what if it's a food addiction? I mean, how do people navigate through that when they're trying to move to a healthy, more, way of being?
Yes. Very good question. I've struggled with tweaking my own diet for the last 20 years. Love carbs, love bread, but they're not good for me. I put on weight, I get a belly when I eat a lot of bread and carbs, processed carbs, that is. And so there are so many people today who are gluten sensitive. You may not be allergic to wheat or gluten, but you're sensitive to it. So gluten and dairy are the first two big food groups that sometimes if you'll just make that change and try to go to whole food eating as opposed to processed food eating, and then if at all possible organic, just doing that, you can eat all you want. So it's the sugar. It's the sugar and the highly processed foods that are so addicting. But some of us love to eat, and so we get confused, right? I don't want to be restricted in how I eat because the only thing I get pleasure from anymore, right? In my case, that's about true. So I can eat all I want if I have fruits and vegetables and lean meats. I'm not going to gain weight. It's true. But you might need help, right? If you can't make these, and I suggest to people you make small changes at first. Perhaps just start by tracking what you're eating. The phenomenon of just tracking your food, and there's some great apps for tracking food. I happen to be using, what's the one? I think it's Fitbit has one. But there are lots of great apps, and it's pretty simple to track. And once you track, you start becoming aware of what you're doing, and it's interesting how just being aware will alter your behavior. But there are programs for people who are truly having an eating disorder. I mean, if you're just truly binging and feeling out of control, I would get professional help for that. And there's 12-step programs. There's other programs that are even more intensive. And, of course, there's specialist doctors who actually handle bulimia or anorexia or those sort of eating disorders. But to begin with, for most people, it's about starting to make good choices. You know, you can watch portions if you like, but honestly, if you'll just switch to healthier foods, real food, as opposed to that comes from a factory, you'll start feeling better right away. For so many people, I'd say easily 50% of the population is gluten sensitive and not aware of it. So going gluten-free or dairy-free or both often can make a huge difference in how you feel, right down to brain fog and energy. And, of course, if weight is an issue for you, you'll be amazed at how easy it is to shed some pounds when you start eating whole food diet.
Do you find that's really tough for people to get off the sugar? Is that like a thing that you can take a while, or is it something they're like, you know, they have to kind of wean themselves off? Because I have a friend that went off sugar, and she was having a few bad hair days. We'll put it that way, you know.
Yeah. Oh yeah. So when you first do something like that, going off sugar, you will absolutely go through a withdrawal. You will feel irritable. Your dopamine levels are not where they were before because sugar and processed foods do give you a little hit of dopamine. There's this whole thing called excitotoxins. You want to know the most excitotoxic food that'll just give your brain a zap? It'd be one of those really tasty Doritos. So any chip that has a ton of flavor, you know, if it's got all these different exotic flavors, that's all artificial MSG kind of stuff. Huge excitotoxin. It's going to give you a dopamine rush. You're going to want more. You can't put it down. When you take away all that stuff, so the excitotoxins, the MSG, which, by the way, is hidden as natural flavors in a lot of foods. If you read labels and it says natural flavors, that might be MSG or glutamate, excitotoxin. You want to avoid that. But yeah, that feeling of the blahs in my office, we have so many, like, I work mostly with ladies, and a lot of them love their chocolate and their sugar. So there's always somebody bringing brownies or cookies or banana bread it's so hard to walk by that, right? But everybody's snacking, and it's this vicious cycle. If you take something that's high in sugar or high in processed flour, carbs, you get an instant rush of insulin. Our body will make sure our blood sugar stays even no matter what. So when you put that highly processed food or that high sugar content food into your body, you make this huge insulin spike. And what does that insulin do? It tells the body to store that sugar as fat. So all that sugar quickly goes into the cells as fat, and you probably will overshoot and get hypoglycemic. So your glucose gets too low, and now you've got that angst in your stomach and that craving for some food. You go grab that cookie or that banana bread or that donut or whatever it is, and boom, your blood sugar feels better. You feel instantly more energized. But what happens? Another spike of insulin. And within an hour or two, you're bottoming out again. And then you develop insulin resistance, because if your body sees too much insulin too often at too high of a dose, the cells stop responding. Now the body has to make more insulin to get the blood sugar where it needs to go, and that's insulin resistance. That's the metabolic syndrome. That's what two-thirds of the United States is experiencing. We've eaten too much sugar, too many processed carbs. We're now all over-secreting insulin, and is it any wonder we can't shed the weight, right? Because we've got this vicious cycle of too much insulin, storing fat, bottoming out, feeling irritable, taking more sugar so we can feel better, and that's just a natural thing for most Americans. And if you go to eating real whole foods, non-processed foods, all that goes away very quickly. It's amazing how much better you're going to feel within days.
Well, that is some great advice. I mean, your book, The Addiction Spectrum, is filled with it. It's got some really good information, tips, hope, and advice for people just to kind of move through this whole, how do we, this is what your subtitle is, a compassionate, holistic approach to recovery. And I think that's what people are craving.
Well, Marianne, I apologize if I was sort of a little long-winded with my responses. I hope your listeners got something out of this, and I really am grateful that you were having me on your show today.
Well, thank you so much. And before you go, where can people connect with you and be part of your community?
So my main website from which you can reach everything else is drpaulapproved.com. That's DRPAUL, approved. Approved has two P's. .com. My office website for pediatric stuff is drpaul.md, so drpaul.md. And but from either of those sites, you can get to just about anything I'm doing. And we'll leave it at that.
Lots of great information there. Well, thank you, Dr. Paul. It has been such a pleasure to spend this time with you today.
It was my pleasure, Marianne. Thank you.
Well, thank you, Dr. Paul. It has been such a pleasure to spend this time with you and, of course, to talk about your new book, The Addiction Spectrum, A Compassionate, Holistic Approach to Recovery. Again, if you'd like to connect with Dr. Paul Thomas, you can at his website, drpaulapproved.com. Well, we're at the end of our time today. I would like to thank everyone for tuning in. You're listening to Moments with Marianne. And remember, make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Moments with Marianne airs every Sunday, Monday, Thursday, and Friday at 8 p.m. Eastern and 5 p.m. Pacific Time. Make sure to tune in and visit momentswithmarianne.com for more information.